Well, I was pretty muchly bedridden. I had pain in my back and my legs. I couldn't hardly walk at all. I was using 2 canes to get around what little bit I could get around.
Pain management is the field in medicine involving the diagnosis and treatment of chronic pain problems. Chronic pain absolutely affects more than just the patient's physical body. It can have changes on their mental health, it can have changes on their emotional health, their relationships with their family, their ability to work.
I really didn't have a life until I come here. I mean, before I come here, they give me 6 months to live. And I weighed 110 pounds. I've gained 40 pounds since I've come here.
Chronic pain can be quite consuming to patients, and I think that an important thing to understand is why they call our field pain management, is that it turns out to be a management of symptoms. It's not a cure. We very rarely will take pain away completely, but we try to help patients learn to live with the pain, learn to be able to function in their life, to get back to work, to spend time with their family, to do recreational activities or things that they enjoy doing. And part of our goal is to help them learn how to function in their life and deal with the pain. But I want to be realistic with my patients and help them understand that it's unrealistic to think that it will ever be completely cured. What we have to offer that's unique, other than general practitioner physicians, is to perform things like specialized injections into the spine, implantations of medical devices into the body to help control pain, as well as a large understanding or a better understanding of medications and how they affect the body. Pain management involves more than just the prescribing and taking of medications, commonly referred to by patients as pain pills. What I'm referring to is the opioid types of medications like hydrocodone, oxycodone. Those are Lortab, Percocet, morphine, things like that.
The non-narcotic pain drug, there's no worry with the addiction. With the morphine, I had to come off of it twice just to start back at a lower dose.
Some of the things that we do to avoid having to depend on narcotic or opioid medications are to look into things like procedural interventions. Some of those are spinal injections. Lots of people have heard of epidurals, thinking of them in terms of pregnancy and laboring women to reduce pain, but we can inject steroid medications into the epidural space to reduce pain. And so those are done with the use of X-ray guidance in an operating room, and we do them right up the road here at Park City Medical Center. Spinal cord stimulators are medical devices that administer electrical current to very specific areas in the spinal cord. They help really, really well with treating chronic neuropathic or nerve pains. This is something that is an important part of our practice. Certainly not a first-line therapy, but it's a specialized type of a procedure that can't be done in many places. We've started to look for other types of ways to control pain. Procedures are a big part of that, but there's important emotional and mental aspects, so we involve mental health practitioners and counselors heavily as well.
It's really given me a life back. You know, I can bathe myself, I can put my shoes on, I can take care of myself, where before I wasn't able to take care of myself. It's been a miracle for me.